Hello, my name is Ryan Steele. Today I'll be speaking to you, new UAMS employees, about bloodborne pathogens. As an employee of a large healthcare facility, you'll need to be knowledgeable about these microorganisms and the dangers that they pose. Regardless of the capacity in which you will work, you'll need to know all about how to prevent exposure and what to do in the event that you or somebody else is exposed. So here are some of the objectives that I'll cover today. First, I'll define bloodborne pathogens and I'll provide some examples of various types that you may encounter in the work area. I'll describe who is at risk for exposure. I'll emphasize the importance of avoidance. I'll discuss exposure prevention, and I will also outline the protocol that you should follow in the event of an accidental exposure to yourself or somebody else. So first, what are bloodborne pathogens? We don't have time today to cover every aspect of what they are, but an overview definition is that bloodborne pathogens are infectious microorganisms that are found in human blood that can lead to disease in humans. Some examples of the most common pathogens in healthcare settings are human immunodeficiency virus, or better known as HIV, hepatitis B, and hepatitis C. There are others, but we won't go into them today. These are the organisms that you will have to avoid working in a large hospital. So why do we worry about these? Well, I'll give some examples. Hepatitis B, for example, is a life-threatening blood-borne pathogen and a serious risk to employees that are exposed to blood and other bodily fluids. Hepatitis C is a liver disease that is known to be the most common chronic blood-borne infection in the United States. And HIV, which is fairly well known, is a devastating virus that attacks the body's own immune system. So how do these exposures happen? Exposure to harmful pathogens can occur in a multitude of ways, and I'll cover the most common here today. Please understand that this is not a comprehensive list, and to always be careful when working with patients or medical devices. Needle sticks are the most common route of exposure. Needle sticks and other sharps-related injuries may expose workers to bloodborne pathogens. Foreign blood exposure can happen when an employee or a patient has cuts or open sores. There have been accidental splashes to the eyes, nose, or mouth. Skin-to-skin contact, while a much less likely route of exposure, can occur. Using unsafe needle devices, and the improper handling and disposal of needles, especially in the patient care setting. So who is most at risk for exposure? OSHA estimates that there are currently 5.6 million workers in the healthcare industry and related occupations that are at risk of exposure to bloodborne pathogens. Approximately 385,000 needle sticks and other sharps-related injuries occur to hospital-based personnel each year in the United States. This includes doctors, lab workers, and housekeepers, but especially nursing staff. Nurses are the most frequently injured employees from needle sticks and other exposures. If any of you are going to be working as a nurse on the floor, in the clinics, or in an intensive care unit, you must take extreme precaution to avoid an accidental exposure. Prevention is the best way to lower the amount of exposures that occur in the workplace every year. This can happen in two ways. The first method comes from the employer side. Employers must put into effect exposure control plans with protection measures. These plans include engineering controls, personal protective equipment, or PPE, and employee education materials. According to the CDC, employers should provide information on the selection and use of PPE in healthcare settings and should allow employees to practice how to safely don and remove PPE. OSHA regulations require employers to provide appropriate PPE for employees and ensure that PPE is disposed of properly. Reusable PPE must be cleaned, laundered, repaired, and stored after use. Examples of these PPE controls include needleless devices, shielded needle devices, plastic capillary tubes, gloves to protect the hands, gowns or aprons to protect skin and clothing, masks and respirators to protect the mouth and nose, goggles to protect eyes, and face shields to protect the face, mouth, nose, and also the eyes. The second way that exposures can be prevented comes from the employee side. Employees should avoid contact with blood and other bodily fluids and should limit opportunities for touch contamination by protecting themselves, others, and the environment. Employees should work to not touch their face or adjust PPE with contaminated gloves and shouldn't touch any environmental surfaces except as necessary in patient care settings. Employees should always observe standard precautions. This assumes that blood and bodily fluid of any patient could be infectious. When finished using needles or other sharps, employees should put them in designated sharps containers. All employees, again, regardless of in which capacity you work, should receive vaccines for preventable diseases when possible. Overall, care providers should be aware of the medical history of their patients, especially in regards to the possibility of exposure, and act accordingly. So what should you do if you are accidentally stuck with a needle or exposed to bodily fluids from a patient? You should immediately flood the exposed area with water and clean any wound with soap and water or skin disinfectant if available. What I want to emphasize the most is that you should report this immediately to your employer and go and seek medical attention right away. Delaying any of the measures that I've listed above could be detrimental to your health because of the increased risk of infection. You may experience a situation in which a coworker is accidentally exposed. In this scenario, you should help them. First, however, you must keep yourself safe. Protect your hands, mouth, eyes, or any other part of your body that might come in contact with the person's blood or other bodily fluids. If you need to touch your coworker to help them, use a barrier against blood and bodily fluids such as protective gloves. Wear a mask and eye protection. And most importantly, take extreme caution to not expose yourself. After you have helped your coworker get the medical attention that they need, protect others by using materials such as rope, flags, cones, or tape to mark off the accident site. This will help protect others from exposure to blood or bodily fluids. It is also imperative that you report the accident to your supervisor right away. This has been a very brief overview of bloodborne pathogens and their role in the workplace. Remember, all employees need to take precaution to keep themselves safe and avoid exposure. Those in patient care settings need to ensure that they use safe practices when interacting directly with patients. Waste management employees need to use the proper precautions when disposing of medical waste. Food service employees should avoid transmission when handling food and utensils. Remember, bloodborne pathogens are microorganisms that have infectious potential. Some of these pathogens can cause serious diseases, especially hepatitis B, hepatitis C, and HIV. All of these diseases have acute and chronic effects. While needle sticks are the most common route of exposure, workplace exposures can happen in any number of ways. The best way to treat an exposure is to avoid it altogether. Exposure prevention is key to ensuring a safe work environment for all employees. And if you or another coworker is exposed, remember to follow proper UAMS protocol to ensure your own safety and report the incident to your proper supervisors. Here are some of the resources that I used to put this presentation together. For more information regarding bloodborne pathogens, how to protect yourself, and what to do in case of an exposure, you can find a plethora of information on the CDC website. You can also find the official UAMS policy on bloodborne pathogens at uams.edu. I will say, UAMS bases its policies and protocols on the information provided by the CDC. Thank you for your attention. I hope that you find your new roles here at UAMS to be safe, productive, and friendly. Please feel free to reach out to me at any time if you have any questions, comments, or concerns. Have a great day.